does working out during pregnancy cause you to lose weight, and can it be a problem for mum and baby?
So when you start, if you're working out, there's a couple of things. You actually need to eat a little bit more because your baby needs that food. And what you're eating right now, let me back it up. Your objective should be to work out to stay healthy, not to lose weight. If anything, it's recommended for you to actually gain healthy weight because you need extra weight for you, and you need a baby also needs some weight.
Yeah.
If you are actually losing weight and you're working out, you need to see your OBGYN. You need to see your doctor to figure out what is it that I'm doing. Is it that I'm not eating enough? Or is, because if you're not eating enough, your baby's also not getting those nutrients. So you never want to work out with the objective of losing weight.
Yeah,
Or
it's
not
not
gaining
advised.
weight.
Or not gaining weight, because you should be gaining weight during your
true.
pregnancy.
Yeah.
It's recommended for you to gain weight. It is a normal thing. We need to normalize that. We don't want to get overweight. Yes, you don't want to gain too much weight, but it's normal for you to gain that weight, and you should expect that. This whole thing, you know, and even that question coming through almost makes me feel like, and for me, because I'm in this industry, there's this whole push of where you see a lot of celebrities who gain little or no weight, have babies, and the next day, literally a day or 2 weeks later, it's like they never carried anyone. And so there's all these unrealistic expectations that are put on women.
Yeah, true.
And so as women, when we begin to see this, we're sort of even beginning to think, oh, maybe I shouldn't be gaining so much weight. Maybe I shouldn't eat enough. And now you're approaching that in a very wrong way. So yes, you should gain weight. You should eat enough for you and for your baby. You should. And if you're losing weight, please go see your doctor.
Weight loss is definitely, pregnancy is not the time for weight loss, for sure.
No.
If I have a client who's losing weight in her pregnancy, I'm very concerned. Very concerned, yeah.
Okay. Sorry, let me find them. Can I do sports in early first trimester? Actually, there's quite a few questions about like starting sports in your first trimester.
Starting?
Sport, doing any type of workout. I know I've seen quite a few about working out during your first trimester.
If you have been working out, then it's fine. But again, the intensity level will keep dropping because I think your body changes. Doc, correct me if I'm wrong. Your body changes every week, so the intensity also will keep changing as you keep going. And then also, if you've never done this sports before, and sports I mean competitive sports, please do not. This is not the time to go and try out the sport. And also, if you're looking, you can start working out, but again, as Sarah said, you need someone who's a professional at that so that they can guide you and progress you through the pregnancy. But no sports if you've never done it.
And I think a lot of people in their first trimester are battling morning sickness. And
I know.
Like, is that the time really?
You want to thinking about working out?
But it's mental again. Like we come back to this mental thing a lot, but like it's so mental. You don't want to, as much as you know, it's healthy to gain weight. You also don't want to lose yourself in a pregnancy. So you are also thinking like, I gotta get back. I mean, I'm gonna do everything. I'm gonna go to the gym. I'm gonna eat healthy. I'm not gonna eat that. That's also why I remember I saw you, because I was like, look, I am craving all sorts of nonsense.
What did I tell you?
Yeah, and you're like, just let it be. Yeah, let it be. Like if you're craving it,
then have it.
Yeah, have what your body's craving. Those are the only things I could eat at that time. But I think I was really stressed about it because for 3 years I've worked so hard to like get really fit and healthy. So I was really stressing about it, even though I know logically I know I should be gaining a bit of weight and I should be taking it easy on myself. But you just, and also being competitive and like knowing you've achieved all of this stuff, you know, it's hard. It's
Plus you have to remember.
Sorry,
Go ahead.
Okay.
Okay. Your body's changing.
Yeah.
The chemicals, your hormones are all over the place. And if your hormones are all over the place, that's why you'll notice the morning sickness. You're going to notice those cravings come in.
Yeah.
And that's why I say just lean into those cravings.
Yeah.
Because at some point, your body's going to come back into balance. Because now you found you're actually in a better state. It's not the way it was the first trimester. Yeah. So don't beat yourself down. And I think this is important because I think that mental aspect is the part that can put people in a bad state naturally. It's recognizing, okay, I have a baby that I'm carrying. My body's changing hormonally. There's all these chemical signals because it's like there's this new human, so we gotta feed this new human that's coming in. So hormones again being all over the place is going to affect the life as you used to know it.
Yeah.
Now that transition is what becomes difficult, and that's usually our mindset.
Yeah,
It's
we
you
have to
transitioning to just recognizing, okay, it's gonna be a couple of months. Really, it really
Yeah.
will be a couple of months. Even if it's a year, because there's also that postpartum
Yeah.
depression that also happens. But please be seeing a doctor if you're going to experience that. It's recognizing it's only for a short period of time, but after that, as long as my mind is ready after I have my baby to get back to who I used to be, you will get back to it.
Yeah.
So recognize you're in a season, give yourself grace. Lean into those cravings.
Yeah.
I mean, you want to eat your guacamole with, I don't know, with like, there's the oddest cravings that women get.
Yeah.
No, seriously, like I ate a lot of pineapples and I saw someone ask about pineapples. Can you eat pineapple? That, my first daughter, I craved pineapples like there's no business. I remember my husband waking up midnight one day. I was like, I swear, come on, I need a pineapple like right now. And so what he did after waking up that night, the next day he went to the supermarket, stocked the fridge with pineapples. Because like, I ain't doing these midnight runs anymore, right? So it's just recognizing what are the things that what are you leaning towards? Lean into them.
Yeah.
My other daughter, it was hamburgers. I don't eat hamburgers. I have never liked hamburgers. But it's like, all I wanted was hamburgers with pickles.
Yeah.
It was the weirdest thing. So lean into that. Yeah, lean into that. You're going to say.
I was gonna say I don't think there's a blanket answer for that question. Everybody's first trimester is
It's
so
very
different.
If
Yeah.
you've lost like 5 first trimester pregnancies, maybe this is not the time to start any exercise. They're just trying to survive this trimester to actually
True.
get this baby to the end.
Yeah.
So there isn't everybody's first trimester is so different, and for me first trimester is such a precious time. I don't want anything started in the first trimester for anybody, because especially if this is somebody I've not known their history before.
Yeah. Your fitness,
And then even when I do get to know their history, maybe you're a first-time mom, I don't know how this first trimester is going to go for you. I can tell you, look, you can start, doing this kind of exercise, and then in 10 weeks you call me and like, look, I'm bleeding.
Yeah.
So I don't really want a lot of changes in the first trimester as a gynecologist, but as long as we're able to push through the first trimester and you can get through all your nausea and everything at 13 weeks and everything is fine, that's the time I kind of let
Relax a little
let
bit.
the reins go a little bit. I'm like, okay, you can do a few more things. Now even you will want to do more things because you'll feel more comfortable.
Confident.
But there's no blanket answer for that one. Everyone's first trimester is
It's
completely
different.
different. Yeah.
Don't they actually say, like, don't tell anybody yet until
Until
after
after
12
3
weeks?
months?
Because it's like, now you're sure the
Yeah.
baby's
First
there.
trimester
Yeah, it can be
is
tricky. Yeah.
Oh, coffee. I get that a lot because I drink coffee, but I only do now one cup a day.
Yeah.
But yeah, coffee.
So I'll tell you about coffee. Coffee is very individual, number one. Let's first talk about working out. When you're working out, there's actually benefits that's been shown. It's actually helpful for you because it helps shoot up that adrenaline, the cortisol, so you're actually able to work out a lot more. So those are some new studies that just came out with coffee. Now, on the inverse side, you've got to understand your own metabolic history and how you actually respond when you have things like coffee. Now, there are people who are called or known as fast metabolizers, and others are slow metabolizers, meaning when you take in coffee, the caffeine in there, for some people, it gets into your system really quickly and it's out really quickly. For some people, it's very slow.
Okay.
I tend to be a slow metabolist. I've actually stopped caffeine. I'm not pregnant, but I've stopped caffeine because it's actually been affecting my sleep for the last... And I started taking coffee in 2020. So I was never, like a coffee person, but it's completely affecting my sleep. Even taking a cup at 10 a.m. Because for me, I've just recognized it affects the sleep. Now, with caffeine and with baby, you also first need to understand if you as a mom, how do you metabolize? Your baby may come out different, but anything that you do, things get passed on to your baby. So they usually recommend a little bit, like about a cup, 8 ounces is usually the recommended amount. Try not to have as much also throughout the day because even you can also be awake, baby can stay awake. So you want to be very careful about the amount of coffee that you have. Yeah.
I'd agree. 1 cup a day is what is allowed. But remember also tea has caffeine.
Yes,
as
caffeine
well.
is everywhere.
Tea
It's
has,
not
and
just
there's some
coffee.
women who are just like, I'm trying to get my breast milk to start coming in even way before, or they just were used to drinking lots of tea throughout the pregnancy. So for tea, we also have a limit. It's about 3 cups a day as well. So because it has the caffeine amount accumulates as well. So if
It
you're going
does.
to do like 8 cups of tea a day, then you might as well have 2 cups of
Coffee.
Yeah.
That's such a
Makes
good
sense.
point because
Yeah.
people only comment on coffee.
Yeah,
Yeah.
tea has
No, I
caffeine
think
as
so.
well.
Even
Tea,
green
yeah.
tea. Even green tea.
has
Even
caffeine,
green tea.
yes, yeah.
And also, can I just also add in there one thing about caffeine, folks to be mindful of, especially if you tend to be anxious. It's actually one of those things they say, can you kind of reduce that?
Reduce it, yeah.
Because it's been shown for a lot of people to sort of help with that as well. So,
Can someone work out with a high-risk pregnancy?
Absolutely
No.
not.
No.
Absolutely
No.
not. I'm
No.
not gonna mince my words.
No.
Because and by the way, I think it's really important that we talk about what is a high risk pregnancy. Yeah. So a high risk pregnancy is a woman who's lost pregnancies before. All right. That's already a high risk pregnancy. Even if there's nothing going on in this pregnancy, just the fact that she lost other pregnancies
Yeah.
that's high risk.
makes her a high risk pregnancy.
Okay.
Twin pregnancy or any other multiple is a high risk pregnancy. So
Okay.
twins, triplets, quadruplets, all those are high risk pregnancies.
Okay.
Women who have an abnormally placed placenta, all right? So placenta previa of all grades, because I saw a question, someone was asking, can I work out with a marginal placenta? And what that means is that your placenta is at the front of the uterus instead of at the back, so that's already a problem. And then it's coming to get closer towards the cervix. So for some women, it covers the cervix completely, where we call it a grade 4 placenta
Yeah.
previa. And then there's some where it covers partially, and then marginal is where it's just touching the tip of the cervix. Now, why exercise is absolutely not recommended at that time is that if you did a squat and part of that placenta that was touching the cervix lifted off from the uterine wall and you started to bleed, that's it. Once a little bit lifts off, almost the entire thing can go off, or it can remain like that and you can end up bleeding like way throughout your pregnancy. Now, if it's partially covering, that's another no, because there's a part that's just kind of hanging over the cervix, and any kind of movement, in fact, for such women, we give them complete bed rest.
Wow.
Because that is a serious situation. Those are women who we allow, you're in bed, you're in the toilet, you're in the living room to eat, and you're back in bed.
Wow.
Yeah, because it's so easy to lose a pregnancy at that point. And you see, the thing is, do you really want to be starting exercise when your placenta is not in the right place?
No.
Like, that's not the time.
Yeah.
You will get to do all these things. All these things can be done and recover. There's no problem. There's no emergency. There's no rush. Just like get through your pregnancy. And then women who've gone into preterm labor before, so women who go into labor 26, 27 weeks, exercise is a no for them, because that can set you off into preterm labor. Women whose amniotic sac ruptures way before they're in labor and way before they're anytime next to their due date. So 30 weeks, all of a sudden your water broke, and that happened in a different pregnancy, exercise is a no for sure. So these are high-risk pregnancies. Women who have severe hypertension in pregnancy, severe, like serious heart disease in pregnancy, lung disease. They say that women who are have gestational diabetes in pregnancy actually should exercise because it makes the outcomes better. But if you are like, you're having preeclampsia in pregnancy, and frankly, sometimes I wonder, I'm like, I'm going to sit here with preeclampsia and still want to work out?
Yeah.
Right? Maybe not. Maybe
No,
not.
I'm
maybe
going to
not.
want to try and get through
Yeah.
through my pregnancy and see how far I can take it, because this is a pregnancy that even your gynae knows is probably not going to get to 40 weeks. And so we want to try and take it to as far as we can.
Possible.
And if you not working out is going to get me to even 32 weeks,
Yeah,
then I'm going to take
I'll
that
take that.
option
Yeah.
as a
Yeah.
gynae, as opposed to you working out and then at 26 weeks we're looking at each other like, what do we do?
I know.
So those are absolute contraindications for any, physical activity in
Yeah.
pregnancy. Yeah.
It actually goes back to mindset. Like, you just have to switch it.
Yeah, a lot in pregnancy and in life.
Yeah.
Is mindset.
Yeah.
Okay, let's see.
And also be willing to make the sacrifice. Just
Listen,
wait for
it's
that
a short- it's a
12
short
months. My God,
period.
it's a very short
It's
time.
very
It's a-
short.
It's a sacrifice for your baby.
It
is,
for
and
for you,
yourself.
and
Yes.
for you.
Yeah. Wow, we sacrifice a lot.
Yes.
Okay. Oh well, alcohol during pregnancy.
That's a no. You gotta think, when you take alcohol, the first thing the body sees alcohol as is a toxin. So the first thing the body will do is, let's quiet everything out. We have a poison that has come into the body. How do we get rid of it, right? So it goes into the liver. And listen, you have a baby that's coming up. I've heard stories of moms who are either alcohol addicted or drug addicted, and their babies have been born with
Fetal alcohol syndrome.
FAS, yeah. So they are born with that, and so it becomes and those children, I watched a docu a very long time ago. They're actually going the withdrawal symptoms that people who are detoxing go through, so it becomes very difficult. So yeah, I would definitely say try as much as possible to stay away from
But you
alcohol.
seem like in many like European countries, it's
They
like
do.
a practice to
There
not
is.
a practice. Like, I mean, it's normal to like have a glass of
glass
beer
of-
or a glass of wine I mean, you know,
It's a hard no for me. Sorry.
it's a hard no.
Yeah.
Hard no.
For me, yeah. I mean, I yeah. Other than the fact that medically, but also morally, for me to sit and say it's okay for women to drink in pregnancy would just be ridiculous. It's a hard no.
Mhm.
Frankly, I have heard of, women can take a glass of wine in
I've heard
Italy.
that too.
Happens
Yeah.
and all that. And in my opinion, and it may be a very biased opinion, I just feel like they're just lucky to get through their pregnancy, And it's not that they're alcoholics, because for alcoholic women, I mean, fetal alcohol syndrome is real. And the saddest thing is those babies are so innocent and they suffer so much just because somebody, I mean, if you have an addiction, I understand it's not something you can control. You need therapy, you need all sorts of things. But if you're not an alcoholic and you can control the amount of alcohol you take, can that amount please be zero? Yeah, that's why it is for me.
Can that amount be zero? That should be the heading of that clip.
Yeah.
That clip, Tatiana, can that amount be zero? Huh?
Okay, let me see. Do you really need your mom during pregnancy? Okay, no, that's not health and fitness, but like, yes,
Do you need your?
mom.
Are you kidding? Yeah. If my mom was here, I'd have wanted her around.
Yeah, my mom was so like, she was beside me every
Through and
pregnancy
through.
in the hospital. Yeah, and that was I couldn't have done it.
Was that question during pregnancy or during delivery?
It just
both.
said during pregnancy.
Oh,
Is it okay?
Pregnancy is
Yeah.
long. So.
Yeah.
I mean, yeah.
In my
Maybe
head, I would
not
have
the
thought
whole
delivery.
pregnancy.
Yeah.
In my head, I was also thinking
Delivery, that's what I thought.
Oh, during pregnancy, yeah.
She said
yeah.
during
Okay.
pregnancy.
Can exercise cause shortening of the cervix?
No, I don't think it can, honestly. There's some women who have a short cervix. We call it an incompetent cervix. And here we're looking at a cervix that's less than 25 millimeters. So when you have a scan and your radiologist says that, you have your cervix is less than 25 millimeters, for me, that's a red flag. But for us, our red line is the 25 millimeters, which is 2.5 centimeters. Now, women who have generally had a short cervix in their previous pregnancy actually should probably, in their current pregnancy, before around say 13 to 15 weeks, have something we call a McDonald's stitch. So we literally stitch your cervix together like with a purse string, and it keeps it closed all the way to 40 weeks comfortably, and that's what we want, because some women, their cervix just opens from nowhere. So once you've had a McDonald's stitch placed, you can have moderate to light activity, and it's allowed. However, if you've always had a short cervix and you keep going into preterm labor, then I'm gonna say no. But if that has never happened to you, and all of a sudden you have a scan and your doctor tells you have a short cervix, light activities like walking and the rest, I don't think are going to make it shorter, but your OBGYN will review and tell you, like, look, this is what I feel is safe for you, and this is what is not. Because I've had patients who actually have a short cervix and then they do their next scan and it's back to normal. I'm just like, what was that about? You have no idea what that was.
Yeah.
And so I feel like your OBGYN will be able to assess, but if there's already any concerning thing to your OBGYN, like, don't push your luck. Just, they say you have a short cervix, just
Okay, so.
keep it together, it'll be fine. Yeah.
If there are any foods and exercise to incorporate for vaginal delivery?
Generally, when it comes to nutrition, you don't want to isolate it and say, oh, it's just for vaginal delivery. Nutrition is nutrition that works holistically. So you cannot begin to isolate and say, oh, I need to eat XYZ because I am going to deliver vaginally.
True.
That is the wrong approach and the wrong question, and it's sort of like the wrong way to approach it. The way to approach it is you want to ask yourself, what am I eating for myself that's going to give me proper nutrients to keep me healthy and make sure that my baby is healthy? So in a nutshell, don't overcomplicate it. Don't make it, I gotta eat XYZ foods. No. Consider eating a balanced diet. You've got your carbohydrates, you've got your protein, you've got your fat in there. You do need a prenatal multivitamin, so speak to your OBGYN to tell you, okay, you would need, there's some things that may not necessarily be found in abundance in nutrition, so you would need that from a multivitamin, from your a prenatal multivitamin. So talk to your OBGYN and say, which is the best multivitamin I should take. But in terms of nutrition, literally, keep it simple. Do not complicate it. Yeah.
The same thing
also
goes for
wish-
exercise, yeah? Sorry.
Go ahead.
I think the same thing goes for exercise. There's no specific exercise for vaginal delivery, so you just have to work hard.
Yeah.
Yeah, and as I said, there's no exercise I'll be like, oh, vaginal delivery, NCS. No.
Yeah.
Yeah.
I mean, there's stretches and things you can do. Pelvic floor wise, it's a lot about relaxing your pelvic floor.
Yeah.
Because I think there's a misconception that, and I've heard from many people, I've got to strengthen my pelvic floor to
Yeah.
push the baby
Yeah.
out.
To push. Yeah.
It's completely wrong. You have to relax your pelvic floor to allow the baby out.
Yeah.
So for sort of the few weeks before delivery, we say to people, do a lot of breathing exercises, pelvic floor relaxation, and just stretches for opening up your hips, going through positions of labor. So there's birth prep stuff you can do,
Yeah.
but it's more on that relaxation, stretching kind of mobility stuff.
Yeah.
Interesting. Okay.
Yeah, and what I would want women to do more of is open up their mind to the kind of delivery they're going
Yeah,
to have.
exactly.
If you have
Yeah.
a healthy pregnancy and you work out during pregnancy and you end up having a cesarean, that's not a horrible thing.
Yeah.
Because I believe that cesarean was to either save your life or
Or
the
the
baby's
babies.
life.
Yeah.
So I feel like people are so close-minded about having a vaginal delivery to the point that they want to eat things that will make them have a vaginal delivery. It's crazy. You need to open your mind
Yeah.
and just say, look, I would like a vaginal delivery. However, I'm quite open
Open
to whatever is going to be safe for me and my baby. And I think that's a better approach, and it leads to much less disappointment when the delivery happens, because I've had patients that I take through the entire labor, like I'm going to sit next to you for 14 hours and then just before you push I'll tell you, look, we have to do a cesarean because this baby isn't doing
It's
well.
not coming.
Yeah.
And I know you've worked really hard and I know it's been 14 hours
Yeah.
and I know you've been in pain, but this is what it is if we are both to be safe.
Yeah.
Right? And so if people opened up their mind more, they wouldn't focus their nutrition, as Roseanne is saying, towards a particular type of
Yeah.
delivery. That's
Yeah.
not the right approach.
Yeah.
at all,
I think there's a lot of moms that get shamed for not doing it
For
vaginally, which is
exactly.
ridiculous
Yeah,
because
which
the
is
work
crazy.
really starts
I know.
after you give birth.
I was
That's
like, where's
a
the
real.
medal for this vaginal
Yeah.
delivery?
Right?
Like, can I have a monument already? Because I didn't get one.
Yeah.
And I feel like there's you really need to open up your mind. It's the shaming and the fact that people don't understand there's actually no price for any kind of delivery. If that baby had to come out through your nose and it was healthy, I think
So
that's
be
fine.
it.
Yeah.
enough.
Yeah.
Yeah.
So yeah.
Yeah. Everything in motherhood is like everyone shames mothers for
Yes.
They
everything.
do, and there's
Yes.
often a sort
Yeah.
of, C-section is the easy way out.
Mm.
But
Which is not.
It is
It's
the
not
worst.
the
I'm
easy-
telling you,
it's a
I've gone through
nightmare.
both.
Yeah.
The worst.
Yeah.
It's the worst.
You're
It's the
recovering
worst.
from abdominal surgery
Yeah.
with a newborn baby.
It's the
Major
worst.
abdominal
that's not-
surgery, yeah.
It's
Yeah.
the
Not just any
worst.
kind, yeah.
It's the worst.
These
And I think the
questions-
post-op advice that people get after C-section is, again, it's compared to if you had any other kind of abdominal surgery, you get, I mean, as a physio, when I was working in the
Yeah.
hospital, if there was a post-op patient, abdominal surgery, you'd go teach them, coughing, rolling, getting it out of bed, all of the
Gosh.
stuff they needed to
Yeah.
do. For some reason, when this is a C-section mom,
Yeah, nobody gives
No
you
one
that. Yeah,
cares
people are like,
about
you just
that.
had a baby, relax.
Yeah?
Yeah.
You know, so nobody gives you the attention that you actually deserve.
Wow.
Yeah.
I
tells
mean,
you
it
how
was
to do
so
things
bad.
like
It's
get in and
as
out of
bad
bed.
as literally as coughing.
Yeah.
That just that
Oh
You
my
have to
God.
support-
You can't cough, you can't
No.
laugh, you can't
you can't laugh, you can't.
Like,
Oh,
Can't sneeze.
And then it
that's
must be
another
also
show. I'll
hard
just get
mentally.
seriously. No, you know how they say if you only 2% of the population has the following. I had all those.
Oh,
So it was I had
gosh.
the worst.
You
So
had
it
every
was I
effect
had
that
it was
you
the worst. So I
expect.
hate C-section is not a joke.
And then I'm sure even like mentally not being able to like hold your baby.
Are you kidding me? You know you had to pillow and
Emotionally.
Yeah, emotionally. I mean,
Yeah.
you're already going through a lot, and
Yeah.
then not being able to
6
do
months
that.
we had to sleep on the floor.
Yeah.
I could
Yeah.
not hop on the bed. 6 months.
Ooh,
Yeah. So it's not a joke. You're right. Yeah.
All right, this one I also was very interested. I hear that when you deliver, you should request that the baby's umbilical cord not to be cut immediately, as
I
some
saw
vital
that.
blood and nutrients that baby will need in the first few months are still passing from the placenta. Therefore, having baby attached to the placenta at least for an hour is vital. And then, can we even add on that eating the placenta afterwards? I've really been very curious.
So,
Yeah, please.
well, continue.
let's shelve the eating one.
Okay.
Please, I need to know.
But let's talk about that one. So I'm gonna say yes and no to that. So we do have a technique during delivery, and it's called delayed cord clamping. And so basically, the baby's born, and we don't cut the cord immediately. It's very important because there's a lot of transfer of iron between the mother to the placenta to the baby, and so many studies that have been done that show that if delayed cord clamping is not done, children are at risk of developing anemia in childhood. So what we want is that rush of iron to the baby, right? So that the baby does not become anemic and gets really good stores of hemoglobin. So that is a thing, but it's not 1 hour, it's 1 minute. It's literally 60
It's only 1 minute.
because the baby is not going to be hanging out
Right?
there with the placenta.
Right, for an hour.
It is literally 60 seconds. And there's a
Okay.
caveat. So that is for women who have had a delivery, whether cesarean or vaginal, and the baby is not in distress.
Okay.
So if the baby has cried and things are okay, then we can sit around and we can wait for that 1 full minute for that benefit of the baby.
Yeah.
However, if this baby has been born and is not crying, is not blue, is not breathing, is not moving, we cannot afford that 1 minute. We literally cut the cord and then we'll deal with anemia later.
Yeah.
Right? So, and it doesn't mean that every baby that does not undergo this procedure automatically has anemia. It's just there's a risk. So it is 1 minute, and it's only for babies who are born, looking like everything is fine, but any baby in cardiorespiratory distress, that's an absolute no. Or if the mother is in severe distress, maybe she has the baby, there's torrential bleeding, for example. We're not going to sit around waiting for an entire minute. In a minute, we could have done a lot of stuff to save their lives. So it is actually 60 seconds, not an hour, but there is some truth in that statement.
Okay.
Yeah.
And eating with placenta?
Honestly, I
No, I don't.
But
But
I watched it, and when
yeah.
I did watch it, I wasn't an OBGYN then, and I just thought it was crazy, and frankly, I've never gone back to it. What I do know is that cord blood is very rich in stem cells.
Yes.
And some people want to harvest cord blood, and we actually do it in Kenya as well. It's sent to South Africa, and it can be stored, because if you ever get, for example, a leukemia or a lymphoma, and you need to get treated with stem cells, you can use the ones that were there when you were born. There's a way they can be stored.
I didn't know that.
Especially
Yeah.
important in twins, because they usually have the same genetic
Similar.
makeup and same blood group and everything most of the time,
Yeah.
and so that's important to store cord blood. If you are able to do it and afford it, it can be
It's
really
expensive.
it can be very beneficial later in life. As to what eating it does, honestly, I have no idea, because when you take a tissue, for example, any kind of protein or blood water, and you denature it, and because some of them are dried, made into shakes, made into powders, made into, and then you're eating it. I don't know what the immunological or nutritional benefit of any of that is, other than just being creepy. Like, honestly, I don't know, but I'm speaking out of ignorance. I haven't had any patient of mine request me to eat their placenta or whatever. I'm sure the people who do processing of placenta, either to make it into, cakes and powders and all that, I'm sure they know why they're doing it, but I really, really doubt the value. Like,
to do it.
is it cultural?
No,
Is
it's
it
not.
religious?
There's
Like,
a lot
I don't
of,
think it's
there's a huge
nutritional.
movement going. No, there's a huge movement going there. There's actually a book I just ordered, so I'm waiting for it to come. So I'm not going to speak much on it, but I do want to do more research on that, because there's a lot of, I know about stem cell, and I've actually heard the benefits of people who either have joint issues, even people who have skin burns, just using that.
And even organ transplants.
Even organ
Like,
transplants.
it's a serious deal. So
Yeah.
cord blood for sure, but eating
Yeah, I don't know.
eating, I don't know. I mean, let
I
me
think,
go
you know what we said, we stay
You keep us
open-minded.
posted.
Let's stay open-minded.
You keep us
Yeah,
posted.
I'll read up on that.
Yeah,
It's
let's
like
stay
one of those,
open-minded.
Like Hollywood
Yeah.
craves or something. But I
Yes.
actually have heard of people doing it here in Nairobi. So that's also why I just wanted to. I mean, I'm not thinking of doing that, but I'm just
But
curious.
Curious,
storing,
I'm really
I
curious.
believe we stored our kids' cord blood. I believe we did. We
Very
did.
important.
I believe we did.
Very
But
if
I
you
know I've
can.
seen that before. Like the pricing on that is
The pricing
some.
is outrageous.
I had
Yeah,
insurance,
but
so-
very important. Like,
I had my insurance covered, so I
people
think.
believe that like it could treat cancer at some point. Stems,
Wow.
the stem cells you harvest from cord blood, and research is ongoing. So I believe
Yes.
if you can afford it, and if
It's
it's found to
good.
be beneficial later on, more than what we've already known, then it's worth it. But
Yeah.
honestly, eating it will be digested.
But even with digestion,
think-
though, there are, before food is digested, like whatever is necessary, some of those things are put into wherever it needs to go. Like, when you eat fruits, they have the vitamins, they are absorbed. So let's stay open-minded.
One of the last questions we'll touch on is now after delivery.
Yeah.
So maybe even we can touch on a bit of everything. Pelvic floor, nutrition, working
Yeah.
out, how soon
Yeah.
you can work out, anything that you might want to add. Yeah, just to touch on that a little bit. Because I know personally, I feel like I was telling you guys 6 weeks hit and I'm going back.
To
Yeah.
the gym.
But obviously that's not just like there's not one blanket statement for everyone. So yeah, maybe we can touch on that a little bit.
I actually got so many questions about that how soon can you go back to training after delivery? And what I usually tell people is first you need to go see your doctor, get clearance. But what does clearance mean? So what I do with most of my clients, they go to their doctors, then they have to find a pelvic floor therapist, and then from there I can be able to work with a pelvic floor therapist on creating their program. Otherwise, if you haven't seen your doctor, you haven't seen a pelvic floor therapist, then there's no way we can move from there, because then I do not have a report on what I'm working with.
Oh wow.
Yeah.
Okay.
Yeah. So I think a lot of people, there's in that first 6 weeks before you see your OBGYN, you know, there's just gentle things you can do. You can start walking, you can start doing your pelvic floor exercises, but that's about it.
Yeah.
So you can start, and you're going to be, you know, you're going to be lifting your baby, you're going to be doing things around the house, you're going to get that gentle exercise anyway. But that's a time that you're recovering. So you have to give yourself that time. And especially if you've had a C-section, there's a lot of things you can't do.
Yeah.
So at 6 weeks, you go for your check. And then when women come to me, we do a full body assessment. So posture, strength, pelvic floor, functional movements, to figure out exactly where they are. Because every woman at 6 weeks is different.
Yeah.
And even the same woman between different pregnancies is in a
gonna be
completely
different.
different place.
Mm.
So depending on your, you know, your delivery, how your pregnancy was, all of that has to be put together and figure out exactly where you're starting. Because there's a lot of 12-week programs you can buy for postnatal, but you have to be starting at the right level for you.
Yeah.
Mhm.
And it has to be, this will depend on your fitness and everything through your pregnancy, through your delivery, how those 6 weeks have been. If you're a first-time mom, often, you know, that 6 weeks, people come in, it's just chaos. They haven't had time for anything.
Mhm.
Often when it's second or third, they feel a bit more prepared for the whole situation. So usually after they've had clearance from their doctor, I see them do that whole assessment and figure out also what their goals are, because everyone's goals are different, what they want to get back to,
Yeah.
what level of exercise they want to get back to.
Yeah.
But usually things like running and impact exercise, there's guidelines, and these guidelines were the first guidelines they made, which were in 2019. Before this, there were no guidelines for returning to running.
2019?
2019.
Yeah.
That's crazy.
Wow.
It's
Yesterday,
crazy.
actually.
So it was actually a pelvic floor physio from the UK and a couple of pelvic floor physios. And
Was
one
that
physio.
that was a woman, I'm sure. Or no?
Woman and 2 women and 1 man.
See, I knew it.
And they made guidelines for returning to running, because a lot of people run, and for a lot of moms, it's
Yeah.
you know,
So.
that me time getting outside of the house.
Yes, it's
Yeah.
important.
And their guidelines are not before 3 months.
Wow.
So a lot of people, and if they don't have that information, they think, okay, 6 weeks I'm cleared.
Yeah.
Let me go and run.
Yeah.
Let me go and do whatever. And running you can kind of equate with any kind of impact exercise.
Yeah.
So there's a whole assessment to do through pelvic floor, strength, impact and load management that we go through and figure out. We'll do it a bit earlier than 3 months, because then we can figure out, are there any strength deficits and anything we then need to work on to then progress you to that point.
Yeah.
So there's a whole, and it's also a mindset of, when you're cleared at 6 weeks, you're not going to go straight back to where you were before.
Yeah.
Yeah.
You have
There's
to
a whole
build
journey
through it.
and
Yeah.
progressions you have to get through.
Yeah. And then also my advice is, whenever you're ready, it doesn't have to be 6 weeks, 12. It can be a year. It can be
Yeah.
2 years. Whenever you're ready. Yeah.
Yeah.
You don't have to force it.
Don't
Let-
pressure yourself.
yeah. Don't get pressure from the outside, social media, all that. Whenever you're ready.
I think
That's
that
a
is
good
an
one.
issue with the 6 week.
Yeah.
It's, you know, you should be ready to
Yeah.
go, exercise, have sex, do whatever. So people think I should be ready now.
Yeah.
But again, everybody's completely different.
Yeah.
So mentally and physically, you have to be ready. And for some people, that takes 6 weeks. For some people, it takes 6 months,
Yeah.
a year, 2 years.
Yeah.
And you just have to, like we talked about earlier, listen to where you are in that space.
Yeah.
That's a good
When
one.
it
I'd
comes-
say,
go ahead,
sorry.
go ahead.
For me, I'd say that, okay, so we do a 2-week review after delivery and then a 6-week review.
Yeah.
Right? So the 2-week review, yeah, you're not ready for anything. At that point, like, you're not ready for anything, no matter what kind
Yeah.
of delivery you had. But for me, even with this 2 and 6-week reviews, it's very individual, very individual. There's a person who may have had a cesarean section, for example, and then she comes in at 2 weeks and the entire wound is infected, and I have to take you back to surgery. So definitely we're not discussing anything at that point.
Yeah.
And then there are those who come and, you know, you had a vaginal delivery and you come for a 2-week visit and your episiotomy is completely torn and it's like broken down. So we're not talking about anything at that point. Or there are people who actually everything is absolutely fine, but they lost so many pregnancies at that point that they just want to take time to bond with their baby. They're not ready for any kind of anything. So every person is completely different. In terms of return to sex, well, people say usually, you know, about 6 weeks ideally if you had a vaginal delivery, and then for CS it's very individual because some people still have abdominal pain way after 6 weeks, and some people by 6 weeks are absolutely fine. And abdominal pain is a big contributor to being unable to resume sexual activity. If all things are standard and you've had a vaginal delivery, usually by around 6 weeks is when you probably would try. Some people it's earlier, for me it was way earlier. But at the same time we have to review your episiotomy, start you on contraception because I don't want you pregnant at 6 weeks. Yeah, because I've had a patient like that, like it was 6 weeks and she said, okay, let me go home and think about the contraception, I'll be back next week. And she came back next week and
pregnant.
6 weeks?
Yes, at 6 weeks. That's a really early time to ovulate. Like that's crazy. But she wasn't breastfeeding, and she'd had a cesarean, so it was very easy to go back to ovulation instantly. So that's another thing that people need to consider, because the thing is, I think you need to prevent a very early pregnancy more than you want to get back into that lifestyle. But at the same time, it's very, very, very individual. People who are extremely active before and during their pregnancies sometimes are ready after vaginal delivery, and uncomplicated vaginal delivery. They're ready even as early as 2 weeks. So I don't like to draw very hard lines on this is the time you need to do it. You might come back and your wound is absolutely fine, but you're just unable to tolerate that kind, even a walk. You get, and so in that situation, don't push yourself. You will be ready for it for sure, but just give your body time and listen to it, because sometimes you come to your OBGYN and they're like, actually you're very well healed, there's nothing wrong, and I feel like you can return, but you yourself, as you try to return, you're just not able.
True. That's
and so
true.
you should just listen to yourself. There are no hard lines, and it heavily depends on the kind of labor and delivery and pregnancy that you had.
Yeah. So when it comes to your nutrition, the biggest thing is you've got to start early. You've got to start building those habits right from the minute you learned you're pregnant. Because what happens is after you give birth, the thing is a lot of women will go to, I want to lose weight now really quickly. And so now what happens is once they're into that mindset, I want to lose weight quickly, it's when now they're like, okay, what do I need to do to lose all this weight quickly? And that's now when all these other diets, or they're starting to do things that are not very healthy for them and for the baby. And so if you actually started practicing eating healthy when you are pregnant, you've got 9 whole months, 7 months, 6 months to literally build good habits that you're going to be able to carry on even after your baby is born. And so after your baby is born, it's not going to be hard. You're not even going to be looking for, what is this thing I need to do to lose weight? Because you're already doing it from the inception. So it's important when you're looking to, after you've had your baby, what do you do nutritionally? I want you to start before. That's the easiest thing, because you're not going to be starting something new. Why? If you're starting a new habit after you've just had your baby, listen, your baby is going to disrupt your life, okay? That in itself is a new habit that you're starting up. Then you want to start learning how to eat food. That also becomes difficult. Those are 2 things you're trying to do at one time. Our brain does not have that capacity for us to do so many changes within a short period, and that's where a lot of us crash. So what do I tell you? Start early. Eat a balanced diet. You don't need to go on anything insane, anything crazy. You don't need to do any funky diets. I promise you. You're eat our own foods, the foods our grandparents ate. But I also want to caution us, because I think one of the things a lot of our parents do is they give us a lot of porridge. Uji. You know, like a whole flask of uji. And like this is all you gotta eat, uji and jahez. These are the 2. If without these 2, you have no milk. Listen, breast milk primarily is made up of protein. Primarily. That's the biggest macronutrient is there. So you need to make sure you're eating that protein in there, because you want to make sure you're replenishing that breast milk with the protein. So yes, it's important. The uji, that whole flask, no, you don't need that. You know, if you don't, you just need, if you want, because a lot of people are concerned about, if I don't have that, I'm not going to have milk supply. No, drink fluids. Drink fluids. And these come from water, from herbal teas. You can add like fenugreek. So add those things into your diet. You're going to notice your milk supply is going to be fine. But you're making sure your meals are balanced. That's the key.
Amazing. All right. Well, thank you so much for doing this. I think we've touched on all of the questions that they had. And I think we've spread some really important information. And I hope you all enjoyed and have learned something. I think everyone would be able to DM you, like get in touch with
Yeah.
everybody here in case you have any further questions, want to see them personally. Please do get in touch. I will leave, when I'm posting, I'll leave all their details below. So please do check all their pages, all their information. And yeah, thank you guys so much for being here with me
Thanks
today.
for having
It's my
us.
first
you.
panel. Thank you so much.
Thank you for
Yeah.
having us, Tatiana.
Yeah,
We've
this
had
is
fun.
amazing for just bringing us together.
Yeah, and I think we're gonna.
We
have
all
a lot
work
of men.
good for women.
together.
Yes.
Yeah.
And it's a woman team. I love it as
Yeah.
well.
Yes,
Yes.
yes, for